Thanks for staying with us. We have with us, joining us on the studio, is the Permanent Secretary, Federal Capital Territory Health Services and Environmental Secretariat, Dr. Gana Adam. He will be discussing the evolving health sector in the nation's capital and how the public health sector in FCT has improved under the Renewed Hope agenda. Also, we'll be looking at how the lives of the people in the downtrodden has been touched directly. Good morning, sir. Thanks for joining us.
Good morning. How are you?
Very well. So tell us what you've been doing concerning the health services in the FCT.
In the FCT, from the inception of my mandate secretary, Dr. Adedolapo Fashawe, that was around August, September, we started the revitalization of the FCT health insurance because that has to do with the vulnerable and indigent patients, the enrollment exercise to get them on board. Because at inception, the number of enrollees were not much. So we did a lot of campaigns so that we will be able to enroll, especially the people living in the area councils, part of the rural areas. And then we did some campaigns on blindness prevention so that at least we reach at an outreach in Kuje about 3,000 of the populace. Then we also campaigned and vaccinated on the HPV, human papilloma virus vaccine. And then we collaborated and conducted some medical outreaches in Kuje during the first anniversary of this administration in June 12th, early this year. So it's about 3-4 months ago. And then we had the first ever integrated World HIV/AIDS Day, where we also registered people living with HIV so that at least they can be part of the program and some of the secondary infections can be taken care of through the insurance and make them able to pay. We also looked at the hospitals. We have 14 general hospitals in the FCT across the 6 area councils. We renovated under the leadership of Dr. Dolapo Fashawe and our Honorable Minister, His Excellency Nyesom Wike, CON. We also renovated the call rooms for doctors so that at least we can make their lives comfortable, conducive, so that they can give service delivery to the patients, because part of the mandate is to ensure that 25% change in service delivery to the patient is a patient-centered kind of approach so that we can improve their livelihoods. So just to name a few, we have also partnered with the IDB, Islamic Development Bank, World Bank, and the FCT, where our counterpart funds have been paid. That is to prevent malaria in under 5, that's 0 to 59 months, to ensure that at least the greatest killer of the children under 5 is prevented. This is just to name a few of the things we have done around since inception about a year ago.
Hold on, sir. Can you give a figure of, the impact of how your policies that you just ruled out have impacted people? Do you have a number of people that you're sure in the FCT have benefited from this that you ruled out?
So far, within the last quarter, because every quarter we do oversight a number of patients that have visited our hospitals, primary healthcare centers, and also our small outreaches that we conduct. I can tell you we have reached well over 250,000 Nigerians across the board, directly impacted on them.
Okay, so we talked about medical insurance, and people hear the amount of people that are signed up or not signed up, and people just hear medical insurance. Can you elaborate on what a medical insurance is and what it covers and the benefits to it?
Okay. The benefit of medical insurance is a group of people, let's say like 100,000 people are paying to be given full insurance coverage. But But you know, most of the time, it is not the number of people enrolled that fall sick or get ill and get to the hospital. So those who are fit are catering for those who are unhealthy. So that is to say, if you go to the hospital, instead of, if you have a bill of like 10,000 naira, you will end up paying about just 1,000 naira, 10% of the total cost. So that gives you the benefit, reduce costs, and gives you health coverage, and it gives you all the services that you require. So that is the essence of the health insurance, is to reach the unreached and also make it cheaper and ensure that principle of universal health coverage, access to all, is achieved.
Okay. All right. So I think pretty much the Nigerians want to know how you plan to continually communicate and sensitize the public on your activities. I know you're here today, but are there other ways where you're communicating to the more ethnic Nigerians that live in the FCT on all the various initiatives that you have?
Right now, our Department of Public Health is preparing to go around the 6 area councils on chemo prevention of malaria and other activities. And as I speak with you, on Friday, 13th of September, at Buhari Area Council, we are also going to a rural setting. We are preparing to go to the rural setting on Friday as from 9 a.m. to reach all the indigents and the vulnerable people within those areas. So these are some of the things we do. We do community mobilization, we do community sensitization, enlightenment, and we also visit the 17 chiefdoms within the FCT. At every given time, at least max, within every 2 months, we visit one of the chiefdoms and engage with the community, where we interact, know their problems through our primary health care directors within each area council, community health workers, as well as some community volunteers through the ward development committees, where we tell them the services available and the services we can take to reach the unreached. So through that interface with the traditional rulers particularly and the world development committees, we get engaged and we plan for the outreaches. And the other one we are planning, like I said earlier, we're trying to do it on Friday as from 9 in Buhari Area Council, where we will give services, dental, optometry, and other services that is required.
There are outskirts of Abuja as well, like Suleja and all those places. Are you going there? Because one thing I've noticed is that we always deal with the city. We don't deal with the outskirts. We don't deal with the villages. So are you doing your sensitization there in those, all those outskirts?
Yes, ma, because where you say Suleja, Suleja is not part of FCT, ma. Suleja is in Niger State.
Okay.
So, and the Buhari I'm naming to you is just a border town between Suleja and Buhari.
Okay.
So the hard to reach and the renewed hope medical mission that Dr. Adedolapo Fashawe has been leading under the leadership of our Honorable Minister, His Excellency Nyesom Wike, is to reach the unreached. We go to like Rubochi, we go to Zuba, we go to Gwagwalada, we go to Kuje that I mentioned to you that we did during the June 12th. So we don't do it in the city center. Even within AMAC, Abuja Metropolitan, Abuja Municipal Area Council, we go to the outskirts, the suburban areas. We don't do it in the city center because we assume even in the city center we have services for them. So Buhari is not the city center, but it's an area council that is bothering Suleja, and Suleja is Niger State.
Okay.
So with this issue of monkeypox that has been, prevalent now, what are you doing about it? Can you give us more updates on that? Let's know what's going on with the monkeypox that they've been talking about. The pandemic.
I understand. And the monkeypox issue, our team, we have a surveillance team working along with WHO and the Federal Ministry of Health. I think recently they have even been at the airports and other states bordering FCT to see the level of preparedness. So the Director of Public Health, the disease surveillance officer, and other epidemiology personnel are up, and they have been enabled through required logistics to ensure that these issues don't come in, and when they come in, they can respond to it at every time that it comes in. So they are fully prepared, we are fully prepared, and we have done the needful, and our checklists have been all dotted, and we are ready, and we have been informed every 24 hours on the situation in Abuja, FCT.
Thank you very much, Permanent Secretary. We've been talking with the PEMSEC, Federal Capital Territory Health Services, and Environmental Secretary, Dr. Gana Adam. Thank you very much for coming on our show. We appreciate all you've done so far and wishing you the best.
Thank you very much, TVC, for having me. Glad to be here.
Let's take a few comments as we wrap up. I know lots of people are trying to make some comments on our previous.
We didn't take most.
Let's take a few more to it so we can wrap up.
Yeah, so Ogumola says, Amaka, men don't know how to pretend.
Hey, I'm just reading that too. Imagine.
Men don't know how to pretend. Lying and hypocrisy are natural qualities of women. Oga flip very well. Remember that house in my father owned National Theatre? It's not a woman line, it's men line. It begins with, my first wife is a witch. It's you that will come and calm me down. It's a women line, it's a men line. It begins with seeking acceptance to the husband's family and transit to keeping a home. The UK and other Western systems are not designed to keep a home together. It intensifies family instability.
But you know what?
But isn't it men that have a password on their phone and they are talking?
And they say national state of navigate them.
What
and they say they don't know.
There's what Amaka said. Some men are doing it. When they go abroad, they back home. Here, we have to feed baby. Here, we have to change diapers. Here, we have to cook food. And they're doing it because they don't want to get jelly. Now, it doesn't mean that once after the kids are now grown, they've gone out, and you're now in your 50s, and you're now saying, okay, let us relocate back to Nigeria. They won't go back to status quo ante.
That's why
they might go back to status quo how they used to be before.
With kindness, you are kind morning, afternoon, evening of your life. You are not changing. But this is the real message. Akin Ade says, the real issue is being bypassed, and that is the fact that children are taken to the street to live a life of crime.
I read that.
How do they escape from the Nigerian culture and the need for the women? Okay, how does the escape from the Nigerian culture and the need for the woman to feel free by reporting her husband now answers the question of the impact on the children? That impact
is a show on its own.
Yes, a show on its own.
The full show that we need to address separately.
Exactly.
I think it's a very crucial show. Any more comments as we wrap up?
Aomayoma says, is it a must to travel with your wife abroad? Too many complaints coming from about the behavior of Nigerian women to their husbands after leaving the country. Do you know that under this video?
Men are not created for nonsense like this.
So that's another idea. If you have opportunity, leave one wife in Nigeria and you can marry another one in the UK.
Chicken.
So the one that is enabling in Nigeria is enabling.
And then you are not a pretender.
And you're not a pretender.
You have to go. You have to go. Never like this.
It's going to bring back this conversation.
That is all we can take on today's show. It's YK's Vibes that bring this kind of topics. We'll see you tomorrow. Bye for now.
Bye.